The Recovery Ecosystem Podcast is an initiative of Detroit Recovery Project, Incorporated. Our mission is to support sustained recovery, health, and wellness.
Good morning, good morning, good morning. We are so happy to be here to talk about the Recovery Ecosystem Podcast. And we have our world famous Layal, who behind the scenes pulls everything together. What's up, Layal?
Hey, Dr. Johnson, how are you?
I'm good. And we're also excited to have my colleague and our guest, Dr. Lauren Judd.
Hello.
Oh, you hear that voice? Hello. She got the radio voice. Thank you for being a part of this conversation today. We are focusing on the recovery ecosystem, and our topic today is physical health. Taking your body back, reclaiming your physical health. We hear a lot around health and wellness. Health is your wealth. And often, I think it becomes more cliches versus people taking action. And that's one of the reasons why I'm so excited that you've been invited, because you are a nurse practitioner by trade. And I know that, I'm a son of a nurse too. My mother was a registered nurse. Oh. And so I understand that health, I'm sure, is important to you.
Yeah.
What inspired you to pursue a nursing degree?
I would say when I was in my junior year of high school, I took a nutrition class, and learning about that just sparked something. I was learning about the human body was really fascinating. And then I vividly remember my senior year, walking down this hallway in my little school and seeing this Johnson & Johnson nursing campaign, basically choose nursing, discover nursing. And there's no nurses in my family or anything, so it wasn't something that had been instilled in me prior to that. But I was like, well, I really enjoy this nutrition class. Nursing seems like a really cool way to help people. You are blending this science and care together. And so that was when I just decided I would go to nursing school, and the rest is history.
Wow.
Well, that's great that you say that, because there's a lot of really unexpected ties between recovery and nutrition.
Mm-hmm.
I was reading a study recently that there was an Italian alcohol residency treatment program, and the outcome of people who received nutrition education, there was 80% of the participants were abstinent 6 months post finishing that program. And so I'm curious, have you encountered that, kind of same type of treatment philosophy, or use that in your practice?
I haven't directly used it. I will say, as a nurse practitioner thus far, most of my focus has been on helping folks who are still in their active addiction. So I'm doing a lot of harm reduction work. So I don't see too many people on the other side at this point in my career. But I think that makes a lot of sense just in what I know. There's a lot of research around the microbiome in the gut and the connection to mental health. And so there's this brain-gut connection that is really exploding in the research and in our consciousness today. That's really interesting. So it makes sense that the more you're eating whole, nutritious foods, the less processed junk that you're taking in, that the better your overall mental health, and therefore kind of strengthening your recovery and that foundation. So it makes sense logically. Yeah.
Yeah. I just want to say that, one of the reasons I was prompt to really write and talk about health in the recovery ecosystem book is through a variety of experiences with individuals in recovery. And I remember a gentleman had disclosed to me how he had been in long-term recovery for a very, very long time, retired, and was living, but then we discovered that he had prostate cancer. And I asked him the question, were you getting annual physical health checkups? And he told me, he said, no. He said, in fact, I did not do that because I often felt alienated and stigmatized because the nurses would have a hard time finding the vein because I used to shoot heroin. And so he neglected to receive regular physical health screening. And we know that the prostate could have been perhaps prevented or treated had it been caught earlier.
Right.
And so we realize in Detroit, we have a lot of health disparities. And, you know, we often talk about the big three automobile industry, but I don't think we talk and treat the big three in terms of hypertension, high cholesterol, and diabetes, which is the big three.
The trifecta.
They call it the trifecta.
That's what I call it.
Yeah, the trifecta, which is serious. And it all involves, generally, we know that genetics impacted, poverty, environment plays a role, and obviously lack of physical activity. Physical, can you talk about some things that can be done to perhaps prevent the likelihood, and how do you regain control of your life?
Yeah. I think what you touched on with the gentleman's, story that you were saying with his not wanting to go into healthcare settings because they couldn't get blood draws on him, and maybe that stigma in healthcare against people who have substance use disorder is so strong and so prevalent in the healthcare system that it does deter a lot of people. People have had horrible experiences in the healthcare system, in the hospitals, the negative attitudes, the poor language that was directed at them because of their addiction, and really blaming people and seeing it as a moral failure versus a disease. And historically, it's been very recent that people in educational schools, whether it be nursing schools or medical school, are understanding more of the disease aspect. That's relatively new in that world. So that stigma does deter a lot of people, even when they go into recovery. If they had a horrible experience when they were in their addiction, then they will be less inclined to go seek medical care when they do get into their recovery. As far as when they do make that transition and, maybe thinking about how to better take care of themselves physically, I 100% agree. Like, you touched on some great points with the systemic issues that really underlie the health problems that show up. So the high blood pressure, the diabetes, and the high cholesterol. Poverty is such a huge thing in that. If you don't have access to healthy food, if you can't afford healthy food, if there's no green spaces around you to be able to get outside and play and walk and exercise, there's no safety around you, there's violence in your neighborhood and you can't go outside, all of that is going to really negatively impact health. And there's even, I know, some instances where communities are exposed to toxic things in the environment, and it's been neighborhoods that have been kind of like redlined closer to trains and different, chemical factories where cancer rates are higher, and it's these lower income neighborhoods that are kind of forced to be in these areas. Just all the systemic things that go behind that. So what can you really do? I think what we're doing here at Detroit Recovery Project with trying to integrate mental health services with substance use disorder services and the primary care is one great way to approach it. So you're already here accessing services for group, or you're already here seeing a therapist or a psychiatrist. We have mental health, or we have physical health here available. We have primary care. Just make an appointment. Just make your same day stop, like get all of the things that you need in one location. That's definitely one great tool. Education.
Excuse me.
Just education and awareness too. So, and I think like the people that need to be raising awareness and doing the education and talking about how high blood pressure affects your body, how diabetes may present itself in your life, and these things too. And I educate people all the time when I'm out on outreach, like high blood pressure is super common, especially as you start getting in your 40s or 50s or 60s. Genetics does play a big role, but also, like you said, diet and exercise. So if you're not getting any physical activity, your blood pressure tends to be higher. There's evidence that shows just walking like 30 minutes a day for 5 out of days of the week, that getting your heart pumping and getting some physical exercise can actually lower your blood pressure, your systolic, the top number, like 10 points. So just doing that alone can make a big difference. Watching the salt intake, and we're so prone, like it's easy access. You see a bag of chips that's highly processed and has a bunch of sodium, and if you start really understanding how to read food labels, you'll see how much salt is actually in a lot of the food that's more readily available, especially in lower income neighborhoods. All that salt can also increase your blood pressure. So I think just raising awareness and educating people. There's so much information available online, but when it's really coming from within the community and from the people who are trustworthy in the community, that's going to be way more powerful. So just starting with small things, making small incremental changes, not being like, I'm going to go on a diet and lose 50 pounds and I'm only going to eat once a day and I'm going to go to the gym every morning. Like those huge goals, you can build up to that over time, but it's just like small, steady changes. Like, okay, I'm going to watch some YouTube videos and understand how to read food labels maybe, so that when I'm at the grocery store, I can understand what all of this means and I can read labels and make healthy choices. And maybe, instead of going to the gym for an hour every day, I'm not going to commit to that, but I can commit to going somewhere where I can get, a good 30-minute walk in or a good hour walk in for most days of the week. Like making small incremental changes is a lot more feasible than trying to do this huge overhaul. So yeah, education and awareness I think is huge. And then just those small, steady changes to make some positive impacts. And then definitely getting the screenings, like your annual physicals, going to a provider that you trust to be able to get those preventive screenings, and somebody who can really break down the information for you so that you understand your own body is another big piece.
Yeah. And I think it's, and thank you for all that you just said, especially, just piggybacking off of the systemic aspect of, I think we have to be real and really voice poverty is real, trauma is real, emotionally eating is real.
Mm-hmm.
And what I've also seen is when people stop using drugs, they replace that drug use with overeating.
Yeah.
And it's very, very easy to overeat and perhaps eat emotionally when you're stressed out or as a coping mechanism.
Definitely.
And so I think for me, when we talk about overall physical health for individuals in recovery, it's also important to just lift their awareness up and have that self-awareness, because I think we all have different genetic makeups. Some of us going to be thick, some of us going to be slim, some of us going to be looking like me, I'm in my first trimester, eating too much some days. And then, we got fit Brandon over there. He work out 6 days religiously.
Right.
And I think, like you said, we just got to take baby steps.
Yeah.
And just do a little bit. Don't don't have our expectations up too high.
I had another kind of just something I want to paint a clearer picture on, which is why, what's the connection between high blood pressure and diabetes and all these other what we call comorbidities with recovery? I think, people who aren't in our space, I don't know if they can make that connection. Like, why does one thing matter for someone who's addicted to drugs?
Well, I think so. This affects the whole population for sure. So high blood pressure, diabetes, high cholesterol. Again, the more we get in our life, the further along we are in age. When you get into your 40s, 50s, 60s, these things tend to come up just because wear and tear on the body, but there's a lot of things that drive it as well. So again, the diet, lack of activity, and when you combine like the high blood pressure and the diabetes together, it really impacts your cardiovascular system. So really greatly increases your risk for things like heart attack, stroke, kidney disease. And so we see a lot of folks who, you feel fine in your day to day. You feel fine. So they call, especially hypertension or AKA high blood pressure, the silent killer, because you can have it for 10, 20, 30 years and really not have any symptoms. But over time, that high blood pressure that's constantly, pounding down on all of your blood vessels really increases the wear and tear on your blood vessels, especially in your heart and in your brain. So again, increases your risk for heart attack and stroke. How does this affect people differently in the substance use disorder / recovery world? Well, again, I think the stigma prevents people from wanting to engage with any primary preventive services, so less likely to engage in healthcare because they don't want to be looked at differently. They don't want to be judged because of their past. They've had bad experiences, so they just don't want to go to the doctor. And so they don't get their annual screenings. They don't know what their blood pressure is, or they think having high blood pressure is just normal, or because it's hot outside. And there's so many myths around it. And certain types of drugs, so like stimulants, for example, people who may have been addicted to crack cocaine or methamphetamine, because that really spikes your blood pressure, can even have more of a serious negative effect on your cardiovascular system. So again, you don't feel that for a very long time. And so less likely to engage in those screenings to be able to get those things under control. And with alcohol use disorder, obviously the liver is really impacted with that. So having something like fatty liver disease and that can just go along with, again, poor diet, diabetes, high cholesterol. You can never have drank alcohol in your life and have liver disease, from fatty to liver disease. But you combine that with adding the alcohol, even more problems with the liver. So it increases your risk for things like cirrhosis. So there's just so many underlying factors that go behind why people aren't accessing care. Stigma being number one, but people just aren't aware of how these things are impacting their bodies.
So what I'm hearing is that physical health is almost like a pillar of recovery capital. Like you have that, and that is the capital that you need to reach that recovery, or whatever that looks like for that individual.
Definitely. I mean, I think so when you get into recovery, there's so many like emotions and things flying around in your head, where it's like definitely being able to deal with your day-to-day emotionally and like mental health wise kind of becomes the priority. And you can get so caught up in just normal life that your physical health can kind of fall by the wayside. But the more that you're able to build up the recovery capital, like take care of your health and make yourself feel better physically in your day-to-day, then it's all connected. The better you feel in your body, the better your mental health is going to be, and therefore the better your recovery is going to be.
And I'm glad you said that, because I'm going to read a little excerpt out of the book. And on page 77, it says, taking care of one's physical health is a protective factor in the recovery ecosystem for a variety of reasons. As noted earlier in this chapter, the condition of people's health affects the way they feel. If a person is in good physical health, they tend to feel confident, alive, vibrant, comfortable, adventurous, inspired, and optimistic. If a person is in poor health, they can be more prone to feel tired, depressed, insecure, uncomfortable, inhibited, and forlorn. And how a person feels daily affects the quality of their recovery. Feelings also have a lot to do with the desire to use drugs and alcohol to alter how one feels, which I think is vital, because you talked about a second ago, Lauren, is how, when you stop using drugs and alcohol, we've also realized that, if you have a mental health illness and you're taking certain medications, and some are SRI medications, and how that can impact one's feeling and vice versa. And also part of the recovery process and becoming better people and better human beings is taking what we call self-care, taking good care of ourselves. And some people have just poor habits, bad habits, and not knowing how to take care of themselves. And whether it's just habitual or low education, but it's also how do we just have this conversation where it's cool to say, hey, let's learn let's have a day to teach people how to juice, or let's have a day where we just walk for a mile as a group and just, do something fun or ride a bicycle or something. Just being physical active and how that enhances one's self-esteem to a certain extent. And we know if your self-esteem is high, you're going to feel good. You'll be on what I call a natural high, and you'll be better to yourself and others. But it has to start with self. We got to learn how to really not just be cliches and say, oh, I'm on some self-care, because people have redefined self-care these days. But I think self-care is your health and your wellness, something that's going to contribute or attribute to some type of peace of mind, perhaps.
Yeah. Yeah. I mean, I hear that. And I think, too, there's a lot of, resources now to help make that a possibility. I know for me, like, there's a lot of apps on your phone now, right? We all have these phones that can do so many cool things, that can remind us to drink water, that can remind us to, go out for a walk.
That's another big one, just drinking water.
Mm-hmm.
Like, personally, I drink a cup of coffee, 1 or 2 a day. I eliminated soda from my diet a few years ago, and I used to be a big Coca-Cola dude. Mm-hmm. I don't drink nothing with a bunch of sugar in it. And it's sometimes those little changes, because you talked about as we get older, we need to be more mindful of the things we eat and how the things that's accessible is also heavily loaded with sodium or sugar.
And sugar, yeah. Sugar is a huge hidden ingredient in a lot of our foods here in the United States as well, which again increases your risk for diabetes. And so you touched on a lot of great points with just the self-care. And if, you have been trapped in the cycle of addiction for a long time, and especially if you were raised in an environment where it was all around you and you had no example or anybody in your life who emulated that self-care or being, in tune with your physical health, then that can be really hard to know how to do it. So when you get into recovery, having examples around you or access to resources where you're able to learn these types of things, I think is really important as well. Mm-hmm. But definitely, and there's a lot of research to support the fact that exercise and don't even think of it as exercise or like this chore you have to do, like working out. I like to think of it as just like daily movement, like literally just getting in my body and moving my body. That's something that has such a positive effect on your mental health, and a lot of times even more so than like medications alone. So it's all, again, connected, and, medication plus therapy plus daily movement or whatever like brings you joy in your life. All of that can be so powerful.
Absolutely. 100%. And I think I do want to just personally thank you, Lauren, because you've brought a really strong spirit to the Detroit Recovery Project. And I've noticed the interaction with clients where you treat them all with dignity, care, concern, and respect. So just thank you for bringing with that skill. That's something we've been missing, and something I learned, like the value of nurses and how important it is to have nurses who, bring that spirit of dignity to their patients. You've been out on the battlegrounds of Detroit, providing harm reduction services, cleaning wounds, and some things that it doesn't always look like pretty pictures. If you're just cleaning up somebody who may have not been to the shower or used the bathroom on themselves or anything, you do it with care and respect. So I personally appreciate you and all that you do at the Detroit Recovery Project.
Thank you.
Absolutely. And then, another thing I've noticed is when they stop, because I've worked in this industry for so long, I've seen people abstain from using drugs and alcohol, and then they discover they have all these health challenges because they hadn't gone to the doctor in the last 5-10 years. Now they discover that, I got diabetes. I have high blood pressure. I have a tumor. And I think, again, I just want to reiterate why it's so important to have regular, routine physical health screenings at a minimum of once a year. And it's important to have your own primary care doctor.
Yeah.
Get you a primary doctor, get you a nurse practitioner, and the people are out here and they are looking for new patients all the time.
Mm-hmm. Yeah. So being able to, again, get that high blood pressure under control, understand how you can lower your cholesterol, not just with medications, but also through diet and exercise, minimize all the complications that come with diabetes, which, risk for infection, you get, ulcers on you. There's horror stories of getting toes and feet cut off. Like, you can avoid all of that by getting things under control, but you're not going to know where you are unless you go access those screenings and services. And cancer screenings is another huge thing. That's another big part of primary care, is getting your screening so that the prostate cancer, the breast cancer, all the colon cancer can be caught early, because the earlier we catch it.
What's the age recommended for mammograms for women?
I believe it starts at 40, depending on your family history.
And for men, prostate exam, same thing.
40?
Yeah.
Oh, okay.
Yeah, they recommend at least 40 years old and up.
Okay.
Perhaps.
I know colon cancer screening, so you got to start getting your colonoscopies or the Cologuard screening at age 50. And we're actually seeing a lot of younger folks getting diagnosed with colon cancer, even younger than that. So, just being in tune with your body. And to your point of like people getting into recovery, stopping the substances and realizing all these things with their body are going on, it's because you are living in this state of like survival and chaos for so long. You're not really in tune with your body.
Homeostasis.
Just numbing, right? From day to day to day, and constantly chasing that dopamine hit. And so when things kind of settle down and you remove the substance, now you have the opportunity to tap in and really like feel what's going on, and maybe accessing those screenings finally and learning all these things that you didn't even know were there before. And maybe that can feel really overwhelming for people initially, but just tapping into support, talking with other people who are going through it, knowing that you're not alone, all of that can be critical.
Absolutely. In fact, and then it's a lot of myths. I've heard men say, I'm not getting no colonoscopy. Or in some cases, myths around medication for high blood pressure for men. I've heard the myths around, your libido will no longer work, which that becomes an issue.
Yeah.
Or, hearing aids, are not cool.
Oh.
So I'm not going to wear a hearing aid because I don't want to look like something is wrong. I've heard all these different myths.
Yeah.
And I think it's important that we develop messages to really, educate and also embrace people to embrace their own health.
Yeah.
Because these myths that people have bought into perhaps can contribute to their lifestyle as well. Because I think what you're talking about too is lifestyle.
Totally. And you can find a provider that you can have a conversation like, hey, I don't want to jump straight into medications. Like, a good provider is going to use what's called shared decision making. So actually having a conversation with you, what are your goals, rather than placing all these rules on you. Like, you have to take this and you have to do this and you have to come see me again in 3 months. It's more of like a conversation. Like, what are your goals? If the individual like really does not want to go to medication immediately for whatever reason, maybe they just don't like swallowing pills. Like, it could be whatever. Then, a lot of education. Okay, let's start with dietary changes. Let's hook you up with a nutritionist. I think that's covered by most insurances, including Medicaid nowadays, like at least a nutrition consult. So you can start to understand those things. Let's start with the lifestyle stuff. Okay, go to the YMCA, a few times a week. There's so many resources out there that are free, affordable, cost effective, that maybe you just don't know about, going on YouTube and doing some exercises from home. There's so many different options. So let's start with the lifestyle stuff first. Let's follow up in 3 to 6 months, see what happens, see where you're at. Are you making progress? If not, then okay, let's talk again about some of these medications, because if we don't start to get these things under control, these are all the things that can happen down the line. And we want to prevent all of that from happening so you can have a long, vital life.
Excellent. Let me ask you one more question. You mentioned the word dopamines a minute ago, and we know that drugs and food activate dopamines. Do you mind just giving a little small lesson on that?
Yeah. So dopamine, as human beings, we're all getting little dopamine hits through a lot of different things in our everyday lives. But there is really nothing more powerful than drugs, particularly drugs, I would say opiates, that gives you such a strong dopamine hit. So when you get trapped in the cycle of addiction, you're constantly seeking that reward. And so your brain really gets rewired into this reward system to where you're constantly seeking your next dopamine hit. And that, again, that fentanyl, that methamphetamine, that crack cocaine gives you such a strong dopamine high that there's nothing else really like it. And so you get trapped in the cycle. And then when you finally are able to get out of that cycle, and alcohol is a little bit different. It's not necessarily like a dopamine reward system, but it's still giving you this like relief. And so you're constantly seeking that.
And that's more antidepressant.
Yeah.
To a certain extent, long-term alcoholics.
Yeah. Because I don't deal with alcoholism too much in harm reduction. I guess I'm not as well versed in that process. But anyways, so when you finally are able to break free of that cycle and get out into recovery, you kind of have to let your brain rewire that system and finding other ways to feel happy and get reward. Like you still have access to that reward system, but it's not necessarily going to be as like strong. So there's other things that we do. Shopping, sex, food are all these little things that can give you like these dopamine hits, right? And so these are all ways that we can
get. So what is dopamine?
Like
them things that make us feel good?
Pretty much. Yeah. Okay. Yeah. It's like a feel-good chemical. Okay. And so you're kind of flooding your brain with the dopamine with all these different things. It's why a lot of people get addicted to social media, because you're getting these small little like hits of dopamine, and it just does something to our brains. And that's another way that you can get like trapped in the cycle of the dopamine hit too, is just through like your phone, and so when we're able to kind of like give ourselves space to step away from that system, let ourselves breathe, mindfulness, meditation, just getting out in nature are some ways to kind of slow everything down and break out of that cycle, because it's just a temporary, like craving that you're satisfying. It's not really like long-term satisfaction.
That's so important, I think, to highlight is okay, so when you're using, you're getting used to, your brain is getting used to the routine of, I get all this dopamine all the time. And when you stop, you almost have to expect that there's going to be like a down period because your brain is rewiring.
Yeah.
And so when you take care of your physical health and all of the things that we were talking about today, then you lessen kind of the extra pains and, struggles that come with, recovery in general. So I think that tells like a really nice story there of kind of painting that picture.
Yeah, the more you're able to kind of break out of those like short-term temporary like dopamine hits and really build more resilience around all of the long-term sustainable like satisfaction and joys that you can get out of life. It takes time, it takes support, it takes community, but there is a path forward.
Yeah, and I like the word you used a minute ago, rewiring the brain. The brain becomes wired to activate or to use drugs that activate the dopamines. And that's another reason why I believe it's so easy for people to be more prone to find certain foods that activate those certain dopamines. And the foods that...
The sugar, yeah.
It's usually the sugar rush, or in some cases it's the salt rush, or whatever it is, whatever the vice is. The vice for me is fries, hot fries with some salt on them.
Right.
I just want to eat one.
Yeah.
And it's a fresh basket of hot fries. And the next thing you know, I got ketchup.
Yep.
And what's in ketchup? Loaded with sodium.
Right.
So I think I want to continue to have this conversation with you, Lauren, if that's okay.
Absolutely.
I think this is just going to be an important part of some of our ongoing conversations is words from Dr. Lauren Judd. That would really be great. Any last minute words, you guys?
I don't don't think so. I appreciate you having me on, and this was a great conversation. And yeah, I look forward to continuing it.
Thank you. It's been an honor to have you on our show. And Leah?
Yeah, thanks. It was wonderful. I knew as soon as we were planning for this episode, I'm like, Lauren Judd needs to be our guest, and you did wonderful. Thank you.
Yes,
Thank you, guys.
absolutely. Okay, well, thank you so much. You all have a great day. Again, this is the Recovery Ecosystem podcast, and today's discussion was physical health.
The Recovery Ecosystem Podcast is produced by Detroit Recovery Project, Incorporated. If you or someone you know needs support for substance use or mental health, call 313-365-3100 or visit recoveryfordetroit.com. You are not alone.